By the way, that next month at this time, fully half of the states in this country, maybe more because they seem to be added to the list every day, will allow essentially everyone who wants to get vaccinated to go ahead and get vaccinated. There's a survey out right now that shows 7 out of 10 Americans have either had one dose of a vaccine or plan to in the weeks ahead. That would be 70% of the population if it bears out. Doesn't always bear out, but I want to pick up on that point with Dr. Devi Nampiaparampil, a physician, also a good examiner of what's been happening on this front as vaccinations pick up considerable steam. Doctor, the pace of this is picking up, expanding the base of those who can get these doses is widening out. Where do you see, the overall vaccination rate a month from now? If it's a third of the U.S. adult population, or roughly that now, what do you think it'll be next month?
Well, I think it will be significantly higher. I mean, the pace seems to be picking up, but my biggest concern is, are we vaccinating the most vulnerable people? So, for example, in the past month, I've probably talked to thousands of people, many of whom are patients. And when I talk to them, so I'm a pain physician, I treat people with spinal cord injuries, disc herniations, all kinds of spinal disorders, arthritis, cancer-related pain, really vulnerable patients, right? And what they tell me is that the majority of them are not vaccinated. So if I ask them why, since they're eligible for the vaccine, they tell me different things, that they cannot stand in line for mass vaccinations for hours, the transportation there is not available. For example, public transportation is not accessible enough, that their insurance will pay for medical visits transportation, but not for transportation to get vaccines. And they also tell me that, they're a little bit confused about what's the difference between an emergency use authorization, which they see as rushed, versus full FDA approval. So there are a lot of reasons for this vaccine hesitancy, which is how we would dub it, I guess, among this population. But if we continue at this pace, sure, we're going to make it even harder for them to get access to the vaccine. And these are the people that probably need it the most. So I think from a practical point of view, our government, this is in New York, needs to focus also on how do we get the vaccine to people rather than bringing people to the vaccine, whether it's through medical offices, whether it's through home health agencies or visiting nurses. And that's the only way that we're really going to be able to protect the vulnerable from a vaccination point of view. And for those that are eligible, if we lower the ages, we may be able to increase the vaccination rate, but it's going to be even harder for those who might be able to overcome these challenges to actually compete with younger folks who may be more digitally savvy, and just in general, the large number of people that would be competing for the virus, but to actually compete to get the vaccine and to get their slot. So I think it will actually make it a little bit more difficult.
Having said that, the CDC Director, Rochelle Walensky, talked about this impending doom. I guess she was referring to what's going on abroad in places like Brazil and India, where cases are really spiking, in Brazil, where deaths are really spiking, and in Europe, where it's sort of a hodgepodge of inconsistencies, but the rollout has been, fair to say, a disaster of vaccines there. And that she wants to really force states and get the president to force states to get back to honoring some of these restrictions that were in place, like mask wearing and distancing and all the rest. What do you make of her plea of don't get ahead of your skis here?
Well, I mean, I was moved by her plea. She clearly cares about her patients and about the American public, so I was touched by that. The hard part about the plea is that there are not very many concrete steps about what people at home, even if they want to help her, what can they do? So if it's to wear masks, people can wear masks without a mask mandate. And I actually am in favor of wearing masks in public, but the mandates are tricky because of the penalties. So if you have a mandate in place, if people respond more effectively, I think, when you ask them to do something versus when you threaten them with a punishment, and will the punishment actually match the crime? So that's a little bit tricky there. But then in terms of physical distancing, I think we can safely reopen with the masks and with physical distancing, and we've done it in many places. So I think that, the concrete steps have to be outlined. And personally, I think that this plea may be, rather than being directed at the public, should be directed towards Congress and some of the people, the lawmakers that actually can create financial incentives to allow the public to follow what they're being asked to do. Because for the most part, from what I can see, people who are having struggles with this, really it's more related to their financial situation and a lot of the other challenges they have in terms of taking care of their families and being able to provide for themselves. So if there could be something done that could actually align the government's goal, the CDC's goal, and the public's goals, and maybe in a more nuanced approach, then that would be a more effective strategy than kind of financially incentivizing people to do all different types of things and then making a plea for them to go against what makes sense for them financially.
I don't know. You're a great doctor, but the government doesn't do nuance. So we'll see how that goes. But thank you very, very much. Dr. Nampiaparampil, physician extraordinaire. Let's raise this issue the good doctor raised with Congressman Dan Muser of Pennsylvania, Republican there. Congressman, I do want to talk to you about this government spending efforts and more stimulus to come to infrastructure. But what if her point that she made that on heeding some of these warnings from the CDC director to be careful and not get ahead of ourselves? What did you think?
Well, look, we're in a far better place right now than we were a couple of months ago or several months ago, and the vaccines are rolling out. People are still wearing masks. I think we need to be smart. We need to be safe.